Thinking about becoming a certified medical laboratory technician, the MLT ASCP credential can open doors to better pay and career growth, but you need to understand every eligibility route and prepare the right way. Stay with me as we cover all. For official routes, the exam details, and a full study plan so you can pass on the first try. Welcome to MLSIAcademy. We help laboratory professionals succeed with ASCP certification. This video focuses only on the MLT ASCP medical laboratory technician certification. You will learn what the credential means, how to qualify through each route, how the exam works, and how to prepare without wasting a single hour. The MLT ASCP stands for Medical Laboratory Technician, certified by the American Society for Clinical Pathology. It proves you can perform critical laboratory testing in chemistry, hematology, microbiology, immunology, blood banking, urinalysis, and laboratory operations. Employers view it as the gold standard for national competence and patient safety. With this credential, you qualify for higher salaries and wider opportunities in hospitals, research labs, public health, and private diagnostics. Let's start with the official eligibility routes. You must meet one of them exactly as listed by the ASCP. Route 1: associate degree from a regionally or nationally accredited college or university, or 60 semester hours of academic credit from an accredited college or university, and successful completion of a NACLS or ABHES accredited MLT program. Within the last 5 years, the education from that accredited program is valid for 5 years from completion. Apply before that window closes so your training remains acceptable. Route 2: this route once required a valid CLA ASCP certification. It was discontinued on January 1, 2023. If you read outdated guides or blogs that mention CLA, ignore them completely. There is no longer a Route 2 option for the MLT ASCP. Route 3: associate degree from a regionally or nationally accredited college or university with 6 semester hours in chemistry and 6 semester hours in biology. These credits may be earned within or in addition to the degree or 60 semester hours of academic credit from an accredited college or university with the same chemistry and biology requirement, and successful completion of a 50-week United States military medical laboratory training course within the last 10 years. This route is ideal for service members and veterans who completed military lab training and want a recognized civilian credential. Route 4: associate degree from a regionally or nationally accredited college or university with 6 semester hours in chemistry and 6 semester hours in biology, or 60 semester hours of academic credit from an accredited college or university with the same chemistry and biology requirement, and 3 years of full-time acceptable clinical experience in blood banking, chemistry, hematology, microbiology, immunology, and urinalysis or body fluids in an acceptable laboratory within the last 6 years. You must document experience in all required areas, but you do not need 3 full years in each one. Those are the only routes that qualify you for the MLT ASCP exam. Choose the one that matches your education and background before you apply. Now the application process: gather official transcripts and any documentation of military training or clinical experience if you studied outside the United States. Arrange for an approved credential evaluation. Submit your application on the ASCP website and pay the current fee of $225. Once approved, you receive an eligibility notice by email. You then schedule your exam with Pearson VE within a 3-month testing window. The exam itself is computer-based and follows a detailed content outline. You will answer 100 multiple-choice questions in 2.5 hours. The test covers chemistry, hematology, microbiology, immunology, blood banking, urinalysis and body fluids, specimen collection and processing, laboratory operations, safety, and quality control. Questions measure applied knowledge and critical thinking, not just memorization. Expect scenarios that require interpreting abnormal results, troubleshooting instrument errors, and applying quality procedures. Results appear on screen immediately after finishing the exam. If you pass, you will receive an official certificate within a few weeks. The credential is valid for 3 years, and you must complete the ASCP credential maintenance program with continuing education to renew before it expires. Now, let's build a proven study plan. Start with the ASCP content outline as your blueprint. Print it and break it into weekly goals so you cover every domain. Use active recall instead of passive reading. Close your notes and teach the concept out loud. Create flashcards and answer practice questions daily. Review every mistake until you can explain the correct reasoning. Simulate full-length timed exams to build endurance and control anxiety. Track your scores by topic and focus extra hours on any areas scoring below 80%. Safety and quality control topics appear often and carry significant weight, so give them extra attention. Do not cram the night before. Steady practice and adequate rest produce stronger retention than late-night marathons if you work full-time. Schedule short daily study blocks of 30 to 45 minutes and add longer sessions on weekends. Mix question practice with focus theory review. Use spaced repetition so difficult material appears again until you master it. Stay consistent and keep a log of your daily progress. Thousands of laboratory professionals have passed using MLSIAcademy's expert-led prep. We provide live classes, on-demand video lessons, concise study guides, and realistic question banks aligned with the ASCP outline. Our system is designed to help you prepare efficiently and confidently without guesswork. On test day, arrive at the Pearson VE Center at least 30 minutes early. Bring valid identification and use the tutorial time to relax and focus. Read each question carefully. Eliminate obvious wrong answers and flag tough questions for review. There is no penalty for guessing, so never leave a question blank after passing. Maintain your credential with continuing education. Complete the ASCP Credential Maintenance Program every 3 years to keep your certification active and recognized. Let's recap. The MLT ASCP Medical Laboratory Technician Certification is the national standard for competence in all core laboratory specialties. You must qualify through one of 4 routes. Route 1, accredited MLT program. Route 2, discontinued. Route 3, military training. Route 4, 3 years of clinical experience. Apply through the ASCP website. Schedule at Pearson VE. And pass a 100-question computer-based exam. Maintain your credential every 3 years with continuing education credits for complete guided preparation. Visit MLSIAcademy. Our next video will show you exactly how to pass the MLT ASCP exam step by step. Subscribe or check our channel so you do not miss it. You now have a full roadmap to earn your MLT ASCP certification. Study smart, stay consistent, and you will succeed.